All right, welcome to our recorded presentation for the open enrollment period for Care Choice Health Systems. We're going to discuss our medical, dental, vision benefits for the plan year beginning January 1st, 2025. My name is Bill Hammett. I'm honored to be your insurance broker. My contact information is on the screen. You're welcome to reach out to us now or throughout the year if you have questions about your plan, what plan to enroll in, how are the plans different, is my doctor covered, what's happening here, and how do I make the best decision for myself. We're here for you. And even throughout the year, Anna and her team are available for you with claims issues, finding doctors, lost ID cards, all that kind of stuff. So please feel free to reach out to us if we can help. Quick agenda, we're going to talk about our timeline for open enrollment, our medical, dental, vision plans, how do I enroll, and where do I go with questions. We've got some exciting new plans available for everybody, so on the medical side, so we'll talk about that as well. Open enrollment starts today, November 15th, and it's going through Tuesday, November 26th. This is the time where you can log in, make choices on the plans you want to enroll in. You can upgrade, you can downgrade, you can choose to enroll in our new Kaiser plans that are available. You can add dependents, whatever it may be. This is your free shot to do anything you want. Once open enrollment closes, you're locked into these plans for the rest of the year. If there is some qualifying event that occurs, such as losing coverage elsewhere, and you want to enroll in the middle of the year, you're welcome to do that. Or if you have some other qualifying health event or life event, such as marriage, divorce, birth of a baby, adoption, these are all qualifying events that allow you to enroll throughout the middle of the year, should you have some of these, any of these events. Any changes that you make here during open enrollment will go into effect January 1st. So even if you log in today, November 15th, and add the dental policy, it won't actually take effect until January 1st. We're asking everybody to be done with this by Tuesday, November 26th, and you will complete all of your applications and enrollment in the EASE portal. We've got a number of different plans available. We have literally something for everybody. We've got 9 United Healthcare plans. We have the Harmony HMO plans in Silver, Gold, and Platinum. Harmony is a sharp-based HMO plan. So if you like sharp doctors, that's who you're gonna want to go with a Harmony plan. The Alliance HMO plans. Alliance HMO network focuses heavily on scripts. So if you like scripts doctors, you want to focus on the Alliance plans. And then we have 3 PPO plans. So if we've got anybody out of state, or you have someone that is, if you're someone that just wants a lot of choice and don't want to jump through the hoops of the HMO process, you can choose a PPO plan. And then very exciting this year, we're adding 4 Kaiser plans. Kaiser has always been a fantastic provider of insurance benefits, a coordinated care system where you can go into them and see a doctor, get a prescription drug, and get everything done in the same facility rather than being bounced to different places. Here are our 6 HMO plans from United Healthcare. I know it looks like 3, but notice at the top, there's 2 silver plans, 1 Alliance, 1 Harmony, 2 gold plans, and 2 platinum plans. And as you look at these plans, your silver plans are going to be the lowest cost plans. They will be the most attractive plans you'll see in the enrollment portal in terms of dollars coming out of your paycheck. But be careful, because they do ask you to pay more out of your pocket should you need to use them. So for the silver plan, we have a $2,400 deductible. And just as a reminder on what that means, a deductible is, generally speaking, what the insurance company says, you must pay all of this number before we start to pay anything. Now, there are some exceptions to that. Anywhere you see this term DED waived, that means they're waiving the deductible, and you get that benefit from day one, $1. So if you're on the silver plan and you need to go see a regular primary care physician, you'll pay just $60, deductible waived. If you need to see a specialist, it's $95. If you need diagnostic lab and x-rays, $45. CAT scan, MRI, PET scan, $400 copay. Physical therapy, occupational therapy, speech therapy, flat dollar copay is $60. So really, really strong benefit plan for those of you looking to save money. This silver plan, both the Alliance and Harmony silver plans, do a great job of giving you good first dollar benefits for that normal day-to-day stuff. Where it gets a little more expensive out of pocket is when you get into a hospital stay, surgery, emergency room. You would pay the first $2,400 100% out of your pocket, then 40%, and United Healthcare pays 60% until all of your expenses total up to $9,200, at which point you pay nothing else for the rest of the calendar year. Notice our gold and our platinum plans have zero deductible. So if you're someone that knows they're going to have some expenses, you're having a baby, you need knee surgery, you have regular MRIs throughout the year, your gold plans here are probably going to be a better buy. They will be more expensive, but you will pay less, a lot less out of your pocket when you have some of these expenses. Note at the bottom here on the big ticket items, hospital stay, surgery, emergency room, the HMO Gold plans have a flat dollar copay versus a deductible and a percentage. So again, if you're having a baby, if you got predictable expenses, especially hospital stays or surgeries, you really should spend a couple extra bucks out of your paycheck to buy up to the gold level plan because it'll save you thousands of dollars out of pocket. And our platinum plan, the biggest difference, our platinum plan is this low out of pocket here of 3,000 bucks. That's the most you would pay. If you got $1 million in claims, once you've spent 3,000 on these platinum plans, you're covered 100% for the rest of the calendar year. Here's our PPO plans, a lot of the same terminology. The biggest difference with PPO plans is the choice of providers. It's the freedom of movement that you get to have when navigating your healthcare experience. With PPO plans, you don't have to go to a primary care doctor to get referrals to other specialists. You can go straight to specialists. So PPO plans, more choice, more cost. HMO plans, less choice, less cost. So if somebody is looking at one of these plans, if you really value freedom of movement and seeing lots of different providers and different health systems, PPO would be for you. One quick note on this catastrophic bronze plan. This is a $7,500 deductible, and literally everything is out of your pocket up to $7,500. So while this is going to be a really attractive premium, you're paying a boatload out of your pocket before you get any coverage from the insurance company. So I'm going to introduce these 4 Kaiser plans, and we're going to go a little deeper. Stacy will jump on and go a little deeper into who Kaiser is, why they're a great option. But again, we have a bronze plan and a silver plan here. These are going to be your lowest cost Kaiser plans. The bronze plan, again, still a catastrophic plan, but this one actually gives you doctor visit benefits, $60 deductible waive for the first 3 regular primary care visits. If you need lab work, notice it waives the deductible for lab work, just a $40 copay. Prescription drugs on a generic basis are only $19, and urgent care waives the deductible there as well. So really solid bronze plan if you're just looking to get the Kaiser and you just want the lowest cost plan possible. One step up from that would be the silver plan. Still, we had a deductible here to contend with, but we've got copays, unlimited doctor visits and specialists, a diagnostic lab and x-ray for a copay, physical therapy, speech therapy, occupational therapy for a copay. A little bit more generous benefits on the prescription drug plan, but still some out of pocket there. Still a good value. Really, when you're looking at value, the silver plans offer a great value. Oh, our gold and platinum ones aren't in there right now. So let's talk. There's our gold and platinum. So here's our gold plans, zero deductible, platinum, zero deductible plans. Our gold fixes a flat dollar copay for hospital stay, surgery, emergency room. Very important if you can predict these expenses are coming up for you, or maybe you're just not comfortable with potentially being out of pocket $2,000 or $3,000 for an emergency room visit. This gold plan is a fantastic option. And then for those of you who have a lot of expenses and are concerned about a lot of out of pocket, and you want to go with Kaiser, this platinum plan caps your maximum expense to $4,500, really limits your out-of-pocket expenses for hospital stays and surgeries, as well as emergency rooms. So I want to hand it over to Stacy here. Stacy, I'm going to give you some of these slides. Just tell me slide when you're ready to go to the next one, but I'll let you talk a little bit, brag a little bit about your company.
Sounds good. Thank you so much, Bill. And hi, everyone. I am Stacy Moskowitz. I am one of the sales executives here at Kaiser Permanente. I'm in San Diego. For those of you that just don't know about Kaiser or are more interested in Kaiser, Bill, I think alluded to it before that it's a one-stop shop. Everything is in one location. You have your office visits, you have your x-ray and lab, you have your pharmacy, so you don't have to drive anywhere. So say you go to the doctor and the doctor requests a prescription, you just walk down the hall and pick up the prescription. So it's really nice. It's conveniently located. We do have a brand new San Marcos hospital here in North County. So that's down the street from the Vista location. So we're really excited about that. And we also have some medical office buildings. We have them in Vista, Carlsbad, San Marcos, Escondido. So those are just the North County ones, but we are everywhere. So, with Kaiser, it's really nice. A lot of it is integrated. So if you were a Kaiser Permanente member, say you were born at Kaiser a few years ago, let's just say 25 years ago, you will have the same medical record number. So your medical record number at Kaiser Permanente stays with you for life. So we will have access to all of your medical records back when you were enrolled with Kaiser. So the one thing that's nice is that we have same day appointments for doctors and office visits. We have lab visits, so you can walk in and get your labs. And we also have 24/7 access. So it's really nice that you have the access to be able to see a doctor anytime at any place wherever you are. And we do have same day appointments at specific locations and also weekend appointments. And all of our virtual visits, that's one thing I didn't mention. We do a lot of virtual visits and we do it with every specialty within Kaiser Permanente, and all of them are a zero copay. We don't charge anything for virtual visits. So anything that you saw on the slide that Bill previously showed, just know that virtual care, there's no cost at all out of pocket. So let's go to the next slide, Bill. Okay, so traveling, I know that people will probably plan to travel because it's the holiday time and everybody wants to know what happens when you travel. So at Kaiser, we do offer travel coverage. It doesn't matter if you are in the US or international, same benefits. If it's an emergency, you are covered. So we just ask you to go to the nearest emergency room and we will be able to take care of you. The other thing, care away from home, and you see that little QR code on the slide. Say you were traveling and maybe you're here and you travel to Hawaii and you get sick while you're in Hawaii. Well, Kaiser's in a few different regions, with not just California. So we're in Hawaii, Colorado, Washington, D.C. So we are conveniently located different area. So if you were traveling to one of those Kaiser Permanente regions and you were sick, you could actually make an appointment within that region and you pay the same copayment as if you were here in California. Now, say you're traveling and something happens and you need to go to the urgent care, we have access to all the CVS Minute clinics. So you can go to a CVS Minute clinic and you pay the same copayment as you would pay as if you were here in California. So let's go to the next slide, Bill. Okay, so value adds. What do you get as a Kaiser Permanente member? So these benefits, they're all incorporated into your benefits. You're not paying extra. This is all inclusive when you choose Kaiser Permanente as a health plan. So the one thing that we did start with is ClassPass. And if you're not familiar with it, I kind of think of it as an Uber Eats kind of. So you go in, you pay per class or per delivery as for Uber Eats does. So you look at a network of classes and you say, okay, I want to go to Tai Chi this week, or I want to go to yoga this week. You find the locations on the ClassPass and you can actually walk into those facilities, pay a reduced, or you have access to all of the online videos that the classes already do, the on-demand videos, and those are free of charge. This is all integrated with your benefits. So if you don't feel like going out for the holidays and you feel like working out at home, you can do that. You just pull up an online video. So that's one thing that we have. And then let's go to the next slide, Bill. We also have self-care. So we understand that mental health is really important, especially nowadays. So we do have access to different tools. One thing that we have access to is the Calm app. You may be very familiar with it. A lot of folks are. I see a lot of commercials on TV these days. So the Calm app is probably the #1 app when it comes to meditation and mindfulness. Usually it's about $70 for a membership a year. If you're a Kaiser Permanente member, it's completely free. It comes with the program. Along with that, we also have access to Headspace. So Headspace, it was called Ginger in the past, so you may be familiar with that. And it allows you to 24/7, it's 3 in the morning, you can actually text with an emotional support coach at 2 in the morning if you need assistance. So it's really anytime, anywhere that you need just some coaching, some guidance, that is available for you. So that is another mental health resource that we have. And like I said, it's completely included into the benefits. Let's go to the next slide.
That was I know you sent me a bunch of them, but I don't want to go too
It's
deep. So we're going
it's
to move on to dental.
okay.
Is there anything that you wanted to touch on that you didn't get a chance to touch on there?
No, I would just say, really the unique thing between Kaiser HMO and another HMO is that you're not locked into a primary care physician. So at Kaiser, you can change primary care physician every day if you wanted to. You don't have to wait first of the following 30 days. The other thing is that it's unique. So Kaiser, if your doctor prescribes or submits for a referral, say you're going in for a specialist and you want to go to a dermatologist. Typically in a HMO, you have to wait. It gets approved by a medical board, and then you get your approval. With Kaiser, the doctors own that approval process. So as soon as the doctor says that, yes, you need to go to a dermatologist, it's automatically approved. So I just kind of want to let you know the nuances of the differences of Kaiser Permanente and how our HMO works versus other HMOs. But other than that, no, I don't have anything else. I just appreciate you letting me talk, Bill. And everyone that's listening to this, you're in great hands. Bill and his team are amazing partners, and I'm going to send it back to you.
Thank you. All right, so we'll move on from medical and we'll talk about our dental and vision benefits. These are all staying the same from previous years. We've got Delta Dental. We got 3 HMO dental plans from Delta. HMO dental plans are fantastic because the price point is very, very low. Super affordable plans. And there's no annual maximum benefits. You never run out of benefits, and everything's a copay. So, from a cost management perspective, HMO dental plans are fantastic. Now, the drawback is there's far fewer providers in the HMO dental network. So, if you got a dentist that you prefer that doesn't take HMO plans, you might need to buy the PPO plan to see that person. But if you're someone that just wants a couple of free cleanings and you're happy to search within the network of Delta to find a provider, these HMO dental plans are very, very affordable and good. So bronze plans are going to be the cheapest. You're going to pay the highest copays when you use it. Silver and gold, of course, they're going to cost a little bit more, but your copays are a little bit lower. Emeritus is our PPO dental plan. We've got 3 of these as well, silver, gold, and platinum. And the big changes with PPO dental is that you have tons more choice of providers. There are far more PPO dentists than there are HMO dentists. So that's a plus. A drawback of a PPO dental plan is the more choice comes more cost. So your premium on a per paycheck basis will be higher than the HMO plan. The other thing to note can be a drawback at times is PPO dental plans have annual maximums. So when you hit your maximum, say I'm on the PPO Gold plan and I have a $1,600 maximum benefit, when I hit this number, I pay 100% of everything else. Emeritus pays no more. So that maximum is for your benefit. So when they pay out $1,600 on your behalf, once they get to that number, they're done. So that's where that platinum plan comes into play. You get a higher benefit allowance there. Vision plans, we got 2 vision plans from VSP. These plans are very, very similar. You'll note that the big yellow arrows are pointing towards those 3 numbers. Those 3 numbers are the frequency in which you are able to access your benefits. So with our gold and platinum vision plan, we have a $10 copay for an eye exam once every 12 months. With both the gold and the platinum, we have a $25 copay for lenses every 12 months. The difference comes into when your frames allowance or your contact lens allowance, it's an or, not an and. You don't get both of those in the same year. With the gold plan, you get a $200 frames allowance or a $180 contact lens allowance once every 2 years or 24 months. The platinum plan gives you this benefit and a higher benefit, 250 on frames, 200 on contact lenses once a year. So There's nothing wrong with the gold plan at all, but the platinum plan is a better value because the platinum plan gives you these benefits once a year and it's less than $24 per year more expensive. So nothing wrong with the gold plan. Great plan, but I find the platinum plan is a much better value because for less than $2 a month more, you're able to access $250 in allowances on frames every single year. Okay. So those are your vision plans. Now, next step, we need to enroll. Everybody is going to be getting an email. So during open enrollment, all of you should have gotten an email already today, giving you an opportunity to log in and enroll. This is what that email looks like. You're going to click on that login button there at the bottom. Notice Anna's email is here. Should you have any questions, you can reach out to Anna if you're having trouble accessing the system. If you have trouble with your password, if there's anything going on that you need help, reach out to Anna. Her and her team are available to help you anytime. Once you get this email, check the junk file folder. This goes to junk quite a bit. If you do not have an email right now, let me know and we will get one set up for you. We'll figure out, we'll troubleshoot what's going on there. The URL is carechoice.ease.com. This is open and live right now. You're welcome to log in. If you didn't get the email, you don't really have to have it. You can go here and log in if you remember your username and password. For those of you who might have forgotten your password because you haven't done it since last year, you just hit this forgot button right here and you can reset it. Once you get into the system, there's lots going on there, but very important is when you get to the medical plans here, you have to either hit the check mark here or hit the X to decline. Check mark means I would like to enroll. X means I wish to decline. Okay, so you got to do that. If you don't do this, then nothing shows up down here. None of these plans down here show up. So this is just a sample, of course, but you can hit the select button and you'll see this big green box open up around it. It tells you you're selected and it shows you your per paycheck amount here on the right. This amount is your cost after the company is paying their portion. So you'll go through all the system, through dental, vision, all that kind of stuff. You're going to choose what you want here. If this is all correct, you'll hit continue. You'll go through, it turns into basically DocuSign. You click the sign forms, you'll type a signature. You'll use your mouse, or if you're using a phone or iPad, you'll use your finger to sign your name. You hit next. Then it goes through the entire application and allows you just to plug in your signature wherever it needs to go. So that's it. What's next? You need to look for that email we talked about a moment ago. You need to log into the portal. You need to make choices on your benefits no later than Tuesday, November 26th. Here's where I get the big question. What if I don't want to make any changes? I don't need to do anything, right? Wrong. Everybody must log in and do something. If you don't wish to have the benefits at all and you waived it last year and you want to waive it again, great. Take you 2 minutes, go through there, make those save waivers, make the same waivers. It'll all be pre-selected for you, sign, and you're done. If you want to keep everything the same as you got it right now, great. 2-3 minutes tops. You'll go through it. Everything's pre-selected for you. Okay. Or if you want to make changes, you want to enroll in something the first time, you're very excited about the new Kaiser offering and you want to change your plan to that, you'll do that through the Ease portal. There is not a situation where somebody does nothing. Everybody must log in and take action. For most of you, this will be a very, very quick process. So please look for that email. Please log in. If you have any questions, if you need any answers, we are here for you now and throughout the year. Please reach out and give us a call should you have any questions. I'm going to end the recording now.